will just kind of mark the area where this pad is soaked in anesthetic.
Okay.
And so it'll sit on there for about 45 seconds.
Okay.
And it's going to do two things. One, it'll numb his eye.
Okay.
And then two, it's going to kind of start to break away that top surface and makes it him easier to polish.
Yes.
Now, the whole time Dr. Tauber was talking to him, he was harping on follow the green light, follow the green light. Obviously, he has covered that up, and so that's why you see his eyes kind of rolling back.
Going back.
Because he's still kind of unconsciously looking for it. So,
okay.
all right, now he's going to go ahead and spray him with anesthetic spray here in just a second. There we go.
Okay.
And so he'll have him, tell him to kind of look up and down and all around to do that.
So can he see anything right now, or is it pretty?
He can see the green light. He can see these white lights here are actually orange in the machine, and so he can see all that. But a lot of it is just, everything's so close and kind of in his face that it's a little hard to tell what's exactly going on. When he does that, he told him to tilt his chin up. And so now he is actually taking the polisher, so I think he might think that, the human reaction to something coming at your face is to duck down. So he's going to have to continuously remind him to put his chin up on that.
Yeah.
This is the AIM Oils brush that's actually doing the polishing. It's a very unique brush in, I don't know what he's doing there. I'm like, where are you looking there?
I know.
In that, Dr. Tauber could sit there and hold that brush there for quite some time. It's made not to go through the next layer.
Okay.
So
Good.
it'll never go deeper than the second layers of the cornea there. So, but basically, now, you couldn't really tell too well on this one. There was a faint outline.
Yes.
Maybe we'll be able to see it on the other eye. But he followed right where that outline was at that first metal
I did see that one.
marker on
yeah.
that. So,
okay.
Now the reason why we don't treat out to the side here is nobody's eye will physically dilate that far, so it's kind of like unused material. Same thing with glasses, all the way out to the very side is not the same prescription as right in the center. So he's just taking away some extracellular debris now.
Okay. Wow. And this is usually really effective, and the PRK works well.
Yeah. Now, for the first couple of days, he's going to say, what did I do?
Yes.
Because as you'll be able to see, kind of right there, it looks more like an apple or an orange peel right now. Do you see kind of those dimples in there?
Yes.
And not nice and smooth.
Yes.
And that'll be more apparent once he gets the laser treatment, because it'll dry things out a little bit more.
Okay.
So, that's kind of, with you being able to see that, if he says, hey, my vision is not what I want it to be, that's where this is, because you'll see how clear it gets when we put water on it, and you'll see how, kind of fogged up and cloudy it'll get when not. So now here we go. We're going to start the treatment now.
Okay.
Okay, so do you see those dancing lights running around there? That's his nearsightedness going away.
Wow.
And now you've got a foggier area in the center. That's where it's not even really heat. This thing actually even cools his eye down a degree.
Oh, okay.
But it's still, it's ablating that tissue, so that's what's leaving that roughness right there in the center there.
Yes. Wow.
Done.
Really?
Done for that eye.
Oh my gosh.
So now he's going to go ahead and put another, this is a pad soaked and cold so that it shocks the eye into starting to heal.
Okay.
And then here comes the funniest part. Not the funniest part. This is the worst part. My brother had this procedure 6 years ago. And the thing that still sticks out in his mind is the cold water that comes gushing after.
Oh.
Right now. Right about now.
Oh, yeah.
Oh, Megan.
Is he covering it?
She covers it up.
Oh.
That's not even fun. But, there, see, she's
funny.
just
Yeah.
gushing him. See, she's being nice. A lot of times they'll gush it. They'll get it all over Dr. Tauber's feet and everything. So she's just being nice.
Nice.
So she had 2 bottles of water actually there for him. I'm sure he'll really love her now.
Yeah.
And then now we're going to go ahead and put that bandage contact lens on.
Okay, and that comes off in a week, I think Bryan said. Okay.
check it. Sometimes it kind of tenses up and
Okay.
squeezes up where we don't expect it to, but
Okay.
most of the time it's fine, and it shouldn't slip out here. Sometimes when he takes the speculum out, it kicks the edge of the contact, and so that's the only reason why you might see it fall out here.
Okay.
Milky drop, that's the prednisone drop that he'll be taking, so
Okay.
it will gum up on him.
Okay.
That's the reason why 50-50, some patients feel they can drive back to get the contacts taken off, and some people don't.
Yeah.
Because, that after a week of doing the prednisone on a contact like that, the contact's gonna suck it up and just really start
Okay.
getting gunky and gross.
Yes. Oh wow.
If that gets debris on his lashes,
Mhm.
we don't want him rubbing the eye, so the only thing that we can tell him to do is get a really warm washcloth and set it on there,
Okay,
and that'll
so-
kind of start to dissipate it.
Okay.
Now, did you get a chance to read that at all?
Not yet, and is this about done?
It's done.
For that?
This
Okay.